go at the end of your instrument pan. You're going to want to make sure when you put them down here, you put them with the curves facing towards the inside. And I'm going to push my pan down to make them stand up. So I'm going to put them all right there. Get my other pickups. All of my instruments that are alike, I'm grouping together, okay? I don't want to have ribbons in all different places and everything. I want it to be easier for me to count everything. And I want to make sure none of my instruments are hanging over the back of the instrument pan. If you place your instruments like this, you can grab them by the handle and pass them to your doctor and stuff. I personally, if I were setting this, I like to keep all of my retractors inside the pan instead of flipping them like this, but I think for demo stuff, we've got y'all doing it like that. All right, so I'm through with my instruments. I got everything laid out and arranged so I can see it, and it's going to be easy for us to count. So now I can come over here and work on my supplies. I'm going to go ahead and put this pitcher and Asepto in the basin so my nurse can pour my saline. When I put my pitcher in there, I'm putting it to the front of the basin so she's not having to lean over it. I'm putting my Asepto, I'm laying it in the back of the bowl. I don't want to leave it in my pitcher because if I stick it in my pitcher, when she starts to pour the saline in it, it's just going to float and may fall out of the bowl or anything like that. So I'm just laying it back there.
And your circulator can come give you your saline anytime, but they have to see it and all that stuff. Sterile water expires October 1st, 2021.
Okay.
Born on date, and I'm breaking the seal.
Alrighty, so you see I stopped to watch to see what she was doing. Now I'm over here, I just unfolded a towel and I'm putting it over in this corner for a place for me to put all of my sharps and everything. I'm putting the big bowl with the lid in the back right corner, the small bowl right next to it, big sponges, big bowl, little sponges, little bowl. I've got my drug labels right here, so I'm going to go ahead and put my medicine cups to the front. You guys, on this skills lab, y'all aren't going to be getting drugs on your field, but your next big skills lab, your nurse will have to place medication on your field and everything, so if you put them towards the front, it'll be easier for her to get to. I'm going to put my marker right beside it so I can label my medications. When she gave me that sterile water on my field, I would need to immediately go over and label it. Okay? In the OR, you're probably going to have a trash bag close to you so you can throw all your trash off of your field and everything, but in here we don't have that luxury. So I'm going to, I guess, pass my trash off to my circulator. I'm going to go ahead and put my suction tip in my suction tubing. That way it'll be ready to go when I go and get everything ready for my Mayo stand. This is just a little trash bag. We're not going to have y'all really stick it, but it's going to go up here off of the front of your table. I'll just stick it under my towel like that. All right, so now I've got all of this stuff set out and ready to go. I'm going to tell my nurse now that I'm ready to count, okay, because I've got everything arranged the way that I'm going to need it. Okay?
Laps.
Pick my laps up. Remember, you don't take this paper band off of them until it's time to count. It's got two bands. gonna throw all my trash in this back corner. All right, when I count the laps, I wanna hold them up so she can see the blue ties, right? And I wanna make sure the strings aren't gonna fall over the front of the table. 1, 2, 3, 4, 5.
Remember, you count together. 6, or do you do 1, 2, 3?
7.
Again?
I just keep going.
Okay.
8, 9,
9,
10.
10.
All right, 2 separate piles, right? Okay. When she asked me that, do you go whatever? It doesn't matter if I
I
went
told them about that
1,
in class.
2, 3, 4,
4,
10.
10.
As long as you come up with the number that you need, okay? So I'm gonna go ahead and put these laps back in the bowl because I've counted all them. Raytech, oh,
Raytech.
she's supposed to tell me what to count. When you're counting these Raytech, if you will hold them by the end where they're unfrayed, they're not folded over, or let that end drop. You don't want to hold them by the end. But grab them by the folded edge, and when I lay these down, she needs to be able to see the blue. Okay? So,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Needles.
I like to use a knife handle as a pointer. I don't like to use my fingers to point because I don't want to get close to needles. Alright, so I'll start with the multi-pack first, right? So 1, 2, 3, 4, 5, 6, 7, 8. That's all I have because my other ones are in the floor.
Oh yeah, circulator missed. Okay, cautery tip.
So when we get to the cautery tip, I have to hold it up so she can see it. I have 1.
1. All right, blade. So I have the blade in my pocket, and this is the type of package that you would project, but again, we're not gonna project the blade onto the field. So I'm gonna crack it open for her to grab.
1.
1. And it is packaged so that the sharp end is down when you open it that way. Injectable.
It's in the floor.
0. Ribbon.
Alright, so again, she can see through the front of this pan, right? I'm not gonna lean over, so I'm gonna go 1, 2.
Deaver.
1, 2, 3. I use this as a pointer, it keeps me from leaning over.
And I need to be able to see her instruments, but I have to be aware of this field here. Okay. Harrington.
1,
Richardson.
1, 2, 3.
Eastman.
1,
Army Navy.
1, 2.
Rake.
1, 2.
Hiccups. Bonnie.
1,
Platform of Tea.
1.
DeBakey.
Have 1, 2 long, 1, 2 medium, 1, 2 short.
Adson.
1, 2.
Knife handles.
Have, go ahead.
Abdominal section and guard.
Oh wait.
Sorry. Abdominal section and guard first.
Section with guard, and somebody screwed this together. So that's not good, right? So I have a section and guard.
Knife handles.
Tell me what I got.
1 long.
Got it.
3 regular.
1, 2,
And then safety.
1.
On the stringer, sponge forceps.
Oh, this wasn't put together in order. See how this is going to screw y'all up? I have 1, 2.
Needle holder.
1, 2, 3.
Mets.
1,
Coker.
1, 2,
Kelly.
1, 2,
Tonsil.
1, 2,
Right angle.
1, 2.
Straight intestinal.
Yes,
Curved intestinal.
got it.
Okay. On the rack. Coker. Straight.
Have 1, 2, 3, 4.
Curved.
1, 2, 3, 4.
Alice.
1, 2, 3, 4, 5, 6. Short. 1, 2 long.
Babcock.
1, 2.
Tonsil.
1, 2.
Right angle.
1, 2.
Kelly.
1, 2, 3, 4, 5, 6. Y'all, when I'm counting the tips of my instruments. I'm not sitting here pushing rings over because there could be anything on the tip of that instrument, okay? So make sure that you're counting the tips. I use this to keep me in order of where I'm at, and it helps me separate those tips so I can see everything. And you can see I use this hand to support the instrument so they don't all flip and flop on me. Okay.
Did I say right angle?
Yeah, we already did Kelly's to Kelly's.
All right. Hemostat.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Needle holder.
I have 1, 2 short, 1, 2 medium, 1, 2 long.
All right. Mayo scissors.
Have 1 long curved, 1 short curved, and 1 straight. Y'all, they should tell you, like, we know the instrument pan, y'all don't. So your circulator should say long curved mayos, and you can say 1. And then she'll say short curved mayos, and you can say 1. All right, so I'm past the straight mayos.
Mets.
1 long, 1 short.
Okay. Towel clamps.
I have 1, 2, 3, 4 biting, 1, 2 non-biting.
Sure it wasn't the opposite way around.
1, 2, 3, 4 biting, 1, 2 non-biting.
Okay. Hemoclipper pliers.
1, 2 large, 1, 2 medium. Is the count sheet wrong?
No.
Oh.
Counts correct.
Did I say it wrong?
She's trying to trick you.
Oh.
I thought you said it backwards the first time.
You said it right.
Thank you, Shantasia.
You knew she was gonna say something.
Question, Angie. I remember whenever we were doing our instrument though, does that have to hang over like from the instrument pan the handles, or do they have to be in?
This one isn't over the outside edge of the
Okay.
table. The pan that y'all had earlier had really long handles.
Okay.
And it hung out, like, it stuck out like this long. This one isn't out past this edge, so it's okay. But it can flip in. The reason I have this one flipped in is because I'm using it as a little holster for my section. You just want to make sure you don't have anything extending past the table edges. Good question.
And now I have to go to the dry erase board and write down the supply count.
So since I'm right here and I just finished setting all this up, I'm going to reach with my left hand, because what happens if I reach with my right hand?
You're back.
All right. So I'm reaching with my left hand with this Asepto. All you do is you squeeze it, keep it squeezed, stick it in your water, suck up the water. Flip it back up, squeeze it again. And you're gonna do that until it's full. All right, it's done. Okay, so I've done that. I've completed this table and counted everything on this table. So next thing I've got is my mayo stand, right? I should have taken this cover over here with me earlier. This mayo stand is labeled where it tells you where your hand should go, okay? So I'm gonna lay it out on the table like this. It's telling me my right hand goes under this cup, my left hand goes under this side. I'm gonna go inside and I'm gonna feel that it's folded up inside there. I'm gonna grab those folds and I'm gonna hold them. So I'm sticking my hands in like that. I'm feeling these folds. I'm grabbing the folds, keeping a hold of them, and I'm flipping my hands up like this, like little guns, because it's gonna make a big mouth on this mayo stand so I can get it on this stand. So when I hold it up, it should look like that. Everybody see it?
Look at me.
Okay? Alright, now I'm ready to go to the mayo stand. I can't touch that mayo stand with my hands, right? This is like a big trash bag that's going to cover that to make it sterile. So to grab this, I can grab it like that, hold on to it, move it however I need to. I'm going to put a foot down here on the base so it doesn't walk away from me. I'm going to start putting this on, but I want to make sure that I hold this, because if I don't hold it, it's going to unravel and hit the floor, okay? So when I start sliding this on, I'm letting this come out, and I'm pushing that on just like that. This drape is too big for this mayo stand, so I'm going to get all of the excess, and I'm going to pull it to the side and tuck it underneath the top of that tray, so it's going to be neat. when I put my stuff on here. I'm gonna get 2 towels, put on top of my mayo stand. I'm gonna lay them out on my table just like this. Why wouldn't I wanna lay them this way? They'll go over the front of my table, right? So I'm gonna pull them out like this. Y'all see I'm not sitting here doing that? Okay. I wanna line one edge of the towels up perfectly. Your towels are gonna be a little bit different sizes, and that's okay. You just want one edge to line up perfect. And that's gonna be what's gonna go to the front edge of my mayo stand. So I'm gonna pick them up and carry them over there. I'm holding both ends up like this. Why wouldn't I do this? It's gonna drag, right? It's gonna load. So I'm picking them up like this, carrying them over here, put them onto my mayo stand. We talked about how I want the front edge lined up perfectly, so I've got it lined like that. This back end of the mayo, I'm gonna tuck my towels under just a little bit. And that's to hold them up there, okay? I don't have any ties. You're supposed to have ties that go underneath.
Is that these?
Nope, that's a suture.
There they are. Ooh, our count is
Okay.
still correct. We didn't count them. Those are
I covered them up though. Alright, so my ties, I'm gonna get out and they're gonna go up on my mayo stand. They've got this, some of them are packaged different. These are some that are really long. So I'm gonna pull this little metal thing that holds them together towards the end of the ties. I'm gonna place the ties up here on my mayo where just a little bit of them hangs over the front edge. That's so I can grab one during the procedure when he wants one. I'm gonna put this towel over the top of them. That's what's gonna hold them in place. I'm gonna flip this second towel back because this is gonna be the layer that all my instruments are gonna lay on, okay? The instruments I'm gonna put up here for this case are gonna be instruments you use for every case, no matter what the case is, okay? What's the first thing the surgeon's gonna do? Cut. So what do I need to grab? I need a knife handle, right? Do I need a long one or a short one? Short, because we're not deep, right? So I'm gonna get a knife handle. After he cuts, it's gonna start bleeding, right? So I'm gonna go ahead, I'm gonna grab some pickups. Do I want long pickups or short pickups? We're just starting, right? I'm gonna get a pair for the surgeon and a pair for his assistant, okay? Because they're both gonna be using stuff. Then if I have to clamp a bleeder, I'm gonna want hemostats. Whenever I put hemostats or any kind of ringed or ratcheted instrument up on the mayo stand, they need to be in the locked position. So they shouldn't be locked when you pick them up off your stringer, but you're gonna wanna click them before you put them up there. One click is sufficient. You don't have to click them as tight as they'll go, okay? So I'm going ahead and clicking them as soon as I pick them up. So you want 2 hemostats. If something's bleeding, you gotta clamp both sides of it. Okay, or if he wants to cut through a vessel, he's got to clamp both sides of it before he can cut through the middle. So 2 hemostats. What does he cut suture with?
Straight.
So I'm going to go ahead and get straight mayo scissors. What does he dissect delicate tissue with? Metz. So I'm going to go ahead and get short Metz and bomb scissors. Alright, so now I've got all the instruments I'm going to need up here. I'm going to put them in the order that he's going to use them. We said he was going to cut first. So I'm going to put my knife blade down first. I'll do it the way y'all have it on your thing. So I'm putting my knife down. Then I'm going to put my pickups. When you set your pickups up here on your mayo stand, I would not suggest nesting them inside each other like that. They're harder to pick up when you want to give them to somebody, if you're having to separate them. So I go ahead and put them up here on my mayo where they're already separate. Alright, then I'm going to put my scissors. I like to put any of my instruments that are ringed, I like the tips facing the opposite direction. And I'll tell y'all in just a second. Then I'm going to put my hemostats next, okay? The reason I like my instruments, the tips facing different directions, is because some of these doctors are going to make you nervous. Some of the procedures are going to make you nervous because you're not used to doing them, okay? It can be an instrument, you know the name of that instrument. But when you're nervous, when you look up here, everything's just silver, okay? So if you have it where the tips are opposite each other, your eyes have to stop when they look at the tips, and they have to refocus every time you look at a tip. If you have all the tips facing the same direction, your eyes don't refocus. They just sit there. And you got the deer in the headlight look. So if you will face them opposite, at least it makes your eyes refocus and stuff, so it might help you grab what you need. Okay? I'm going to cover this up. Majority of your cases, you're going to have a lot more instruments up here. Okay? So I'm covering that layer up. Then I'm going to get everything that's going to go on that top layer. When I set my stuff up, I put all of that stuff together. Y'all know by now I'm very OCD. So I've got my light handles, my suction tubing, I've already got my tip on, I've got my cautery. I'm going to need a non-biting towel clip to hold all of this stuff on my mayo. And I'm going to need 2 lap sponges. Alright? I'm getting it. I'm just setting it up here. Look how neat that looks. I'm done. Alright? That part's finished. Now I'm ready to come over here. Y'all aren't going to have all these extra towels. Okay. Gowns are going to go in this top right corner. Usually you put your surgeon's gown on the very bottom because he's the last person that's scrubbed in. Okay? You can stack your other gowns on top of that. Your drape is going to go in this back right corner. You're going to want to lay the drape on your table the way that it's going to be placed on the patient. So all of your drapes are going to have a picture of a little dude on it. Okay? See the little guy? So it's showing this is the head of the drape is facing this direction. The foot of the drape is facing this direction. It's important that you put them on correctly because these drapes are sewn with extra panels and stuff to cover the arms because the patients, when they're in the supine position, their arms are out to the side and stuff. And so if you put it on upside down, then your arms are going to be down here and there's not going to be anything to cover your arms. So I'm going to lay it here in the direction that it's going to go on the patient. So I'm going to put it just like that. You're putting it in reverse order, or this is the last drape down, so it's going to be the last drape here. This is just a big sheet that they're going to use to cover the feet. Then I've got to make folded towels that are going to square off where my incision is going to be. These towels are folded in a way that you should be able to stick your finger underneath the front cuff, behind it like that. If you grab the folded edge up high, you can run your finger down like that, and there's a cuff in your towel. Did y'all see that? You're going to fold it in half and lay it on top of there like that. You're going to need 4 of those. So finger behind that front folded edge, let it drop down, fold it in half. I forgot to bring towel clips over. So I've got 4 towels there. These are all extra towels right here, so I'm going to stack them right there. These people are going to need towels to dry their hands if they did a water scrub, okay? So I'm just going to get a towel, fold it in half, half again, and I'm going to stick it on top of the gowns like that. And then your gloves can go right here to the side. And that's it. That's where this skills lab will stop.